it's Jess from Head to Toe Health. Going to run through a sleeper stretch. So this is really good for the shoulder, especially posterior capsule. So laying on your side, you can use a pillow under your head if you need to. You're going to bring that shoulder and arm directly out from your body. So you're going to make a 90-degree angle there. You're going to bring the hand down as far as comfortable. And then from that position, you're going to push the right hand up into the left hand. So we're not changing position of the arm, we're just bringing in up to a 30% contraction for 3 to 4 seconds. And then relax the contraction and use your left arm to push that hand down. So your right arm is quite passive in that, it doesn't do anything there. You're allowing the left arm to do the work. Then once you've got to that new range of motion restriction, you're going to push up with that right hand for 3 to 4 seconds at up to 30% of your strength. And then relax. So now your left hand pushes down to get to that next range of motion restriction, next barrier. And then you push up again with that right hand for 3 to 5 seconds, just under 30% contraction. And then you relax and you push down again with that left hand. So you're going to increase the range of motion through that capsule and through that joint gradually. Don't go too far. You want to make sure that you're still comfortable, but you will feel a stretch through the shoulder. If you find that there's too much pain with this exercise, then you can hold that contraction in that position for 10 seconds and then release it and don't change your range. So stay in that position. Do another 10 seconds, hold, again under 30% stretch, contraction, and then relax, and then do your 10 seconds again.